right. Welcome. And we're doing another episode, Renee. Is that what I'm to
We're
understand?
doing another episode. This actually is the episode before the last episode, so we're doing them out of order today. But yes, you're still in Illinois, and I'm still not in Illinois. So those things have
True.
remained the same.
It's true. And I was going to try to find a better background, but I remember last time we tried to podcast together in Illinois and it rained. And it was actually raining earlier today here. And so I decided I'm not going to go outside. I'm not going to try to go find a corner. There's a lot of conferences going on in the main
Oh,
conference venue. So I just
that's weird.
retreated.
Last year there it was pretty wide open. There was like one other one with that big balloon arch and us. So they must have
No,
figured out it was a slow weekend and filled her
yep.
up.
No balloon arches this year, though. So
Oh, darn it. No pictures for you. Have you found any more metal statues or anything to take pictures of on
I
the
have. I
campus?
haven't. I have not told Brent yet, but
Oh,
I have a plan, and there's going to be a short video coming
I
out.
can't wait.
It's
I
going to be
always
a
tell
good one.
everybody that's listening, you've got to check out Jason's social media page if you want to collect all the shorts and all the
Yep,
ridiculousness when he goes on travel. So
one's coming.
good times.
There's one coming.
So today we're going to be talking about the Illinois Rural Health Association conference, and I do feel kind of bad I'm not there. I've been this is my would have been my third year in a row, so I'm kind of bummed on one hand, but not on the other hand. We'll talk about that later. But today we're going to talk about things that we're learning in Illinois that apply to us here. But before we dive right into that, what is going on the farm?
Well, I actually learned something here in Illinois at this conference that I'm going to impart on everyone here. I was given by the Illinois Lyme Association. Ticks are a serious issue, and on the farm, I know that I'm running around in the timber sometimes or outside and find ticks. And this is a full tick removal, tick identification
Hmm.
kit.
Wow.
And it also has little bags. You could have them sent in and tested. And I think sometimes, farmers, rural folks, we don't always take some of this stuff seriously. And Lyme disease can be very serious. And so my farmer complaint this time is more serious, that these are the types of things you should have on hand. And so sometimes not just you should have special tweezers, you should have all of this stuff. So think about that for your family and others. There's some little information packs in there. They do really a nice job here, the Illinois Lyme Association,
Yeah.
of identifying ticks and helping everyone to understand the risks associated with tick-borne
Yeah.
illnesses.
I had an aunt who got Lyme disease from a tick. It's been a bunch of years ago now, but lots of really hard symptoms that come with that. There's a lot of mental health implications with that.
Yeah,
You feel depressed and you feel not well, and it can
yeah.
last a very long time, especially if it's misdiagnosed. And yeah, that's a great organization over there. And I know they're working on. I had a conversation with that association to trying to work on more of a multi-state collaboration and some
Yeah,
training to bring across into Iowa. So hopefully they'll do that because we have just as much timber and as much
yeah.
ticks, unfortunately, as they do. So, and then my friends but deal with that with pets too. So it's
Yep.
not just a farming thing. If you're in the
No,
city and you
yep.
have pets that go outside, I have a friend that right now has her dog has some sort of something that he's collect and they don't know where he's gotten it from, but he's very, very sick. And so, they're having to check all those things. So that'd be a really great kit to have too, just for everybody. So
Yep.
wise place to talk. So today that we're going to dive into what we're learning. And one of the things you mentioned when we're talking today is about the use of artificial intelligence in healthcare. And you must have heard a talk or two about this while you've been in Champaign. And Champaign's always on the cutting edge. They're one of the research institutions that does these kinds of things. And so it's not a shock to me that campus would be talking about this, but it's not something I've heard a lot about, at least not yet in our state. So what are you talking about there? What's related to artificial intelligence? What should we be talking about in that space?
Yeah, so Dr. Patel was here, kind of did a keynote for us this morning. And, it just kind of got me thinking differently about, we all talk about artificial intelligence. We're all using ChatGPT more than we ever have, and that's been a learning curve for some of us that it's not natural, maybe, to think about how can we really leverage the technology that's available to us today to make our lives easier. And I don't think I've always really understood how much it can change practice, when meaning
Hmm.
healthcare practice, and how we can better identify, how we can better treat, and how we can better manage diseases. And that includes behavioral health. And so it really opened my eyes, Renee.
Yeah, I know for folks that I don't know anybody in healthcare that's done this, but for those that are in their space, I know several people now who have uploaded like all of their resources and certain things or certain types of books, certain types of material, and turned it into sort of like a consultant slash coach, kind of reminding you back what the information are in these books. One person had like uploaded all of their favorite parental counselor person's information, like all the books and things.
Um,
And so that when they have an issue that just kind of repeats back to them what's in those books that they, think highly of, that reminds them like, what did I read in those things? And so it makes sense in this space because especially if you were to train this specifically for healthcare, and enter the information in there from your DSM-5, from the different types of research, that you would be able to probably get pretty accurate information related to mental health, which would be very interesting to hear about.
well, I don't know if you've been using it yet or not, but MD Calc, if you go to mdcalc.com, is a tool, and basically it can be used to help walk through kind of different diagnostic screeners for all kinds of issues. And that's based upon doing exactly what you're speaking about. And this is what a lot of healthcare professionals are using to kind of cut through things. And I think, I never really thought about my entire medical record. I've been going to the same clinic since I was a little kid. And so all of my medical records are somewhere, right? Some of them are electronic, some of them aren't. And there's kind of a question about if someone actually was able to access my entire medical record and look at trends and patterns of my health history over time, could that better predict
Wow.
diseases or things for me specifically, right? Because a lot of times we go to the doctor and, why is the age of getting a colonoscopy? It was 55, then it was 50, and now it's 45. Well, it's based upon a bunch of people in a room saying we think it should be this age. It's not really personalized for my own medical history. What if those tests were actually personalized around our own history? And I think about diagnostic tools for behavioral health conditions or prevalence toward being more susceptible to substance use. I think about what if we could take our individual medical records and see the red flags and the risk factors. And I've never really thought about that, Renee, but overlaying that then with all the resources you're talking about, think how powerful a tool that could be when it comes to helping people.
Yeah, I just had to have a preventative mammogram, and they asked me more detailed questions this time than I've ever been asked
Yeah.
about lots of things. So I'm wondering if they're not feeding it into something more like this because it is more
Well,
history questions. If I but it, you're basing it on my
yeah.
recollection or ability to tell the truth about things, right? So
Right.
it's still not necessarily what you're saying. If you had the actual historical information, then you could really narrow down. But, they're asking me, do I have the whatever gene? Well, no, I don't
Right.
think so. But have I really been tested to know for sure? Probably
Right.
not. But as far as I know, I don't. And so it's one of those kinds of things. There's different genetics, different things. And then I have to do a primary care appointment and they maybe update all of this stuff and you wouldn't believe the number of questions.
Right.
So I'm guessing there's going to be more ahead in this space
So
where they're trying to get more of this
we
information to
we
prime that
shouldn't
pump.
assume it's going to be utilized though.
Yeah,
Some
maybe
stats were
not.
thrown around today at 95% of stuff in your medical record will never be utilized, right?
I don't
Because
know why you're asking me
because we
then.
don't have the time or the resources.
It
And
took
this
me
is where,
15 minutes just to check in
right.
for my upcoming primary care
So
appointment. It was
it
15 minutes of just questions and all the different things
exactly
about all these
right.
diseases, including my family history and all these things. And you're right. You may or may not. I had a different doctor recently allergic to a particular medication and that was their favorite for treating whatever. And I'm
Yeah.
like, I'm not going to take it. But I know, been here, done all that, not doing that twice. But, they should have known that. It's pretty
Yeah.
evident on my chart that I can't take it, right?
Well, but I think the power of AI can better bring those things to the top.
Yeah,
And I
agreed.
think this is where the opportunity lies. And we really think about customizing health data and making sure that those things that have happened in your medical history are brought to the top and make sense to those
Hmm.
physicians. Right. And this allows doctors to go back to having a relationship with their patients. It's not about charting and coding. It's about actually getting to know your patient and then tailoring treatment around what they actually need. And so I kind of got excited about this because I'm like, look at all this data that hasn't been utilized, that's been
Right,
underutilized, and how
right.
can this increase precision and the ability for us to do better? And I think it works all across the continuum of care, whether it's behavioral health or physical health. I think this is huge, and I think this is a game changer as
We
we
just
think
have to
about.
figure out how you would enter the data, right? Because you think about like all those screenings that you've talked about at your clinic
Right.
every time you've gone, whether you've done the screenings or not, and you're not sure that anybody's used them, whatever. But if there was a way to capture all of the previous screenings in one place, then really show that predictive pattern, like you're saying, that would be very, very helpful.
And we know what we talk about. You got to fix the problem, you got to fix the system. And this becomes a systems issue. And so I'm going to jump ahead to data because I think this
Yeah.
really makes the point. And I didn't really understand this until I heard it. And then, of course, I had to look it up. And so I chat GPT just to make sure this information's accurate, Renee, because you know how it is. But medical errors are the third leading cause of death in the United States today.
Wow,
The third leading cause of death.
that's
So
really
our
high.
podcasts are about 30 minutes long. 45 people will die in the United States during our podcast from a
Unbelievable.
medical error that could have been prevented, most likely, had we been able to be more precise in how we're treating people and use the data to better quantify what was going on and make recommendations and
Well,
guide our
and
treatment decisions.
I think it would also really save a lot of money. Like there's a lot
Oh,
of us lumped in the same categories. I think about preventative mammograms, and I'm going to go off on
yeah.
a tangent here a minute, and people get mad at me for this every time I do, but I don't care. I've had false positives, I don't know, 10 times, 20 times, I don't
Mhm.
know. And every time they increase the what they can see and improve the technology,
Mhm.
it flags something again, and I'm
Mhm.
back again. I am a waste of medicine. I am a waste of their money, time, resources, and energy. I have absolutely no family history of that, no genetics of that, nothing. So I'm a very, very low risk person, but yet I get thrown in with everybody, treated the exact same way. And I probably could be, if they really had it specified to me, a lot less often screened because
Yeah,
the risk is so low for me.
right.
And so but there's think of that on the terms of how many people we're talking about, and everybody's getting thrown into
Right.
all of those screenings, and it's costing us a fortune to prevent a lot of things that we need the finances for other things that aren't getting caught. And so it's like they've got, there's just certain things that if you could personalize it, you wouldn't have to just keep redoing
Yeah.
it. And I know once you get, certain types of screenings, then depending upon
Yep.
how you've scored, you can come back in 3 years or 10 years or whatever, because they can personalize it to you. And I really wish a lot more was like that, because I can guarantee we're throwing money down the tubes for some of the stuff I have to do every year. And my insurance has to pay it. And that means insurance costs go up for everybody. And I can guarantee I don't need it. But you can't fight that in our country because people can sue if you miss. And so
Mhm.
you then have to do it anyway. But smart screening would be awesome. It just would be awesome for so many things. So I think there's a lot of cost savings measures in here if you could personalize it more for yourself. And think
Well,
about the same for
yeah.
behavioral health, the waste of trials of medications and things that if you could know what could work for somebody and tailor it to them, you'd save all that time, energy, and effort trying to find a medication that would work.
Well, you bring up kind of an issue that came up today. It's kind of a double-edged sword, right? Because as you talk about wanting to do that, then who's most interested in this? It's insurance companies because they want to
Yeah.
save money. And so whose
Yeah.
record,
True.
when you think about your medical record, who owns it, Renee? Who
I would think
owns
I do,
You would
but
think so, but I'm not sure, right? In this day and
don't you?
age, and I know I've brought this up before, and I'm gonna put the link to the video clip of it today
Oh boy.
because I always go back to because we're really I go back to the movie Roadhouse when Patrick Swayze walks in after he's been beat up and he
Mhm.
pops his medical record down. It has his college transcripts in it, his entire medical record. And if you remember, he actually says it saves time when I'm seeking medical attention because I bring all of my records with me and you have access to all of them, right? And we know
Amazing.
today that if I have an MRI in a different hospital system, that probably if I go to a different hospital system other than the one where I received the original MRI, it's going to have to be redone because in this day and age, 2025, we can't send the image file from one hospital system to a different hospital system because they won't accept it. Right, Renee? We all know this is true.
I've heard this. I've heard
And,
this.
and
And when
so,
you're if we are within the system, it can be frighteningly fast how fast you can get results. I mean, I
correct.
told you preliminary mammogram. I knew results in matter of less than 24. I mean, I knew all of it, and
Right.
it was very, very quick. But I was in the same system. I've done it before where there might be a referral and you don't get sent to your right place, and then you're sitting there from. I mean, I have a friend that has breast cancer, and they had found the lump And then the next step got delayed for a couple of months. And they're not blaming anybody, but that just adds on the agony for how
You,
long it takes to get your answers then
if you
because it got delayed or lost.
if you add AI into the equation within minutes, you can indicate with 90% accuracy whether or not there was a red flag in that image or not, right?
Yeah,
Before it even goes to the radiologist to be reviewed. And so,
that's
if
impressive.
we think about how we can speed up this entire process and put less pressure on our radiologists and the specialists and create less stress on the patient who's waiting for those results,
Yep.
the implications are huge. And I
Yep.
think that's a
And I've
perfect
seen
example. Yeah.
I've seen some research on or some images for breast cancer that they can almost predictive where it will start in how in the length of time in a particular person where they've done enough imaging now to know where somebody you can't see it today but will come positive and it has shown to be true. So you can even have some predictive qualities in that of looking at like, hey, there's a good chance this is going to pop up or whatever. And so thinking about how that could really be helpful, we've talked about this all the time, and this is where AI could be helpful too. But when somebody comes in, especially the mental health world, substance use world, have to repeat their story,
Yep.
repeat, repeat, repeat,
Yep.
repeat, repeat. Having a system in AI that remembers who you are, that could track you, you wouldn't have to tell it all those times. It would
There's
know it the first time. So think about the easier the handoff would be within a
yeah.
system to get somebody care where it already had that information stored and ready to go, making decisions based on that. So that poor person doesn't have to just keep repeating the same story over and over. In the
It's a
behavioral health
waste of
space,
everyone's time. It's a waste
waste
of the
everybody's
clinician's
time.
time. It's a waste of the individual's time. We're really talking about accuracy and precision, right? If we're wasting our time telling a historical story over and over again, we're not getting more accurate or precise in our diagnosis or in the treatment path forward.
No.
And so I can't imagine why we keep doing things the way we've always done them when we know
Yeah.
better today about
Oh,
how we can create a much more accurate and precise diagnostic package to help someone move forward, no matter what's going on in their life, physical or behavioral health, or both.
well, I'm going to play the Debbie Downer because I know the
Oh,
answer to why they haven't, Jason. Their favorite subject, HIPAA.
oh,
Somebody's going to try to tell us that we can't do it because it violates somebody's something or other in privacy. Now, if you were crazy enough to go into ChatGPT and lay out George, and George has all these issues, and you tell them all about George, yeah, you've probably violated something. But if you've built a specific internal healthcare record, a little more like your record system, it's
yep,
no more unsafe than records at that point.
right,
It's kind of the same thing. And so you could have an electronic health record that those are considered safe for HIPAA
yep,
and HIPAA compliant. So this would be the same thing. You build it within the secured network for the doctor's use, for the nurse's use, for internal in that system, and not just general population where anybody can just go into chat and learn more about so and so's gallbladder. I mean,
and
that's not what we're talking about here. So I think that there's got to be some policies and rules written around it, but it's already been able to be done. So it doesn't make any sense to
and we
hold
have to
back.
think
But
about
I could see some people trying to say,
right.
oh,
And if we get honest with ourselves, the benefits outweigh the risks. We know that there's a lot of bias, especially for folks with serious mental illness or
yes,
disabilities, when it comes to physical health and addressing physical health care issues.
yes.
This takes away the bias and looks at data. It looks at test results, it looks at blood work, it looks at all of the data points that take away the bias of the stigma of what's happening with that person. And so we know that there's bias across our systems. And this is one way to start to eliminate that and get again precise and accurate diagnostics of what's really going on within that person.
I think of people that I see on the correction side, and by
Oh,
the time I might have them, they
yeah.
may have 6, 7, 8 different diagnoses.
Yep.
And wouldn't it be awesome to have something like this to just clarify what are we actually talking about? And because people make errors and people look different over time and in different settings, they appear different ways. And so humans will give them a different diagnosis. But when you get those folks that come through with a PTSD and sometimes a complex PTSD, plus a bipolar, plus
Yep.
potentially a schizophrenia with some paranoid features, and then you add anxiety, depression, and combinations of a few other things. That person's so confused on what they're supposed to be doing. And you can tell them to be compliant in their mental health and compliant in their medications, but they get really confused as to what they're supposed to do because they'll say things like, well, in here they tell me it's this, but out there they tell me it's that.
Yep.
And so just thinking about clarification for the person of You do it. I mean, they are complex needs and they are
Yeah.
complex types of situations. But one entity that could have all of that information that could then pull out and synthesize for you what really we're talking about would be so helpful for so many people. Because think of again of all the waste and the time, energy, and effort
Oh,
of trying to get them diagnosed and on wrong medications and on the wrong path and the wrong
yep.
treatment plans. And it just gets so frustrating for the person who's just trying to get help. And so that would be a really exciting thing that could potentially help too for those complex cases that sometimes you can't find the right answer. And maybe an AI program could help pinpoint it and say, most likely with these circumstances, this is this. And maybe everybody that's been talking about it is not correct. And so you could get the right, going down the right path.
And it goes beyond AI, right? The technology can extend beyond the walls of your clinic and the EMR, but it can also extend into the wearables and the household stuff that we have
Yep.
access to today. Renee, our friends at Kangaroo Health. We've talked with them a lot,
Yeah.
and they're really focusing a lot on the med packs that they're tracking people in their homes, that they can track behavior and analyze behavior of did they open the med pack at the same time every day? They're tracking vitals to look at, medication adherence as to was the medication having an impact? Is it keeping heart rates low, depending on what the condition being treated is? I think that when you combine all of these to get together, it gives you really good predictive tools as to is what's happening in the doctor's office actually changing behavior at home, and is that making the person healthier? And so I think it's just so exciting to think about all these technologies working together, as opposed to happening in silos or separately.
Hmm.
We talk a lot about the behavioral healthcare system being separate from the healthcare system. Well, that's a really minor silo when we start thinking about how do we integrate all of these systems and technologies. But that really does drive better healthcare, and it drives healthier people and healthier communities.
Yeah, it's pretty exciting. I mean, I know I've had some of my own health issues where it's just hard to pinpoint what it could be. So having a chat with somebody that's smarter than everybody else that has all my history might actually
Mhm.
makes the most sense yet of like trying to get that all put together so you could get an idea of what in the world you've got. Especially when you're landing in, I mean, I've got family that have had just some odd symptomology. It doesn't really match the
Yep.
DSM. It's kind of there, but
Mhm.
not. And you're like, you're stuck. You just can't
Mhm.
really find the right thing. And I've even heard stories as new as this is, there are some people who've put their own stuff into Chat GPT to try to get a better diagnosis. And you're hearing stories about how that's been life changing for them to
Mhm.
help get their own stuff in the right place and be able to take it to their doctor and say, hey, I put all this stuff in. This is what it's saying, and it's right. And so they're finally getting some help, and they're even trying to do it themselves out in the public space because they need the help.
I mean, of course you should use caution doing this, but I'll tell you, it happened this week. My wife and I were walking our dog, and we got halfway through the walk, and she started limping on her left paw. And so Jennifer was dead set. She was going to take that dog to the vet. And I said, well, let's just wait. It might get better. The farmer in me came out, right? I know how to deal with animals. And she put all of the things, everything that happened in ChatGPT, that we were on a walk, the temperature outside, that we had walked over an anthill, all these different variables on concrete. And it came back with probably the best set of recommendations I have ever seen for what to
Wow.
do for the next week until we saw a veterinarian for that dog. And so I think it's a good time to start looking at how can you use those things also to make you a better consumer of medical care when you go in and talk
Agreed.
to your physician or someone else, because you're going to have more tools to help them get to the root cause more quickly than going in without having the language and doing some of that work on the front end yourself.
Yep. Brent came back from Ragbri with something he thought was a bite. And so didn't do the whole big search, but did enough with Google Lens to be able to be like, I think it might be this instead of this
Yep,
based on what I can see. I mean, and give him
absolutely.
a place to start, right? Because he doesn't need, you guys were leaving again. You didn't have time to just
Right.
go stand in an emergency clinic somewhere for something he's not sure if it's an emergency. It just makes some sense. You can kind of get a starting point to be like, okay, this is an idea. I'm sure doctors still roll their eyes though. Old school doctors are like, did you learn that on the internet? But in some cases, you're better off to have an idea.
Yep, absolutely.
So today, the recovering politician self-care policy of the week. You guys all heard about FOMO, fear of missing out. Well, I'm here to tell you I have FOMO, no mo. I do not feel like I'm missing out of going and traveling with Brent and Jason right now. I've got a lot going on in my own life, my own business, and although I'd have a great time, and I do miss the contacts and the network and some of the folks that I've missed, and I will miss them, and I'm sure that you'll hear about that as I'm not there. But I just can't get away, and so sometimes for me, I just have to keep on the steady path. Everything's always bright and shiny and new and fun, and I'd love to do all the travel, and then I'm exhausted. And so right now I just need to be stuck in place. And so sometimes when you're thinking out there about self-care, you got to think about, okay, what can I do less of for a season and not more? So I'm in that less than season for a moment. They won't last forever, and then when I'm ready to go, I'll be out doing more stuff. But for now, it's not a big deal. You're not missing out on much. And so just tell yourself, you got to take care of you. So when you're in the self-care space. So I know about you, you're on the travel path again here for the next, I don't know, how many weeks and a
Yeah,
month
a
again?
couple of yeah,
Yes.
we're traveling east this time, so we got a couple weeks of being out east,
Out
at
east.
eastern states, and it's this is just a great time to be traveling. So I'm grateful for
Well,
the
you get to
opportunity.
see the crops and see
I
exactly how
know,
it's all going down. And so you can
do
compare place to place.
I
So
do.
before we go today, don't forget to follow us on LinkedIn, Facebook, or YouTube. If you leave us a positive review, we'll send you a prize. Thanks, everybody. Talk again soon.